Sexually transmitted infections cross all boundaries, whether they are economic status, sex, age, or ethnicity. With the arrival of erectile dysfunction drugs such as Viagra and the lack of sexual education, the incidences of STIs in the elderly population are on the rise. The purpose of this campaign is to educate the elderly population about the risks of unprotected sexual intercourse, reducing the incidence of STIs, decreasing the potential costs on the healthcare system, and improving quality of life. Contrary to popular belief, older adults are still having sex. 73% of 57 to 64-year-olds, 53% of 65 to 74-year-olds, and 26% of 75 to 85-year-olds. When asked how many seniors are talking to their healthcare providers about sex, the results revealed that only 38% of men and 22% of women engaged in these conversations. This indicates a need for this type of campaign to address this societal health issue in Canada. In a culture where ageism is common, many people do not want to think about the older population engaging in sexual activities. It is this general ignorance that puts the sexually active older adult at risk of contracting sexually transmitted infections. When younger generations are not willing to talk to their parents and grandparents about safer sex, it becomes a taboo subject surrounded by shame, causing the older adults involved to avoid asking questions and, in turn, limiting their knowledge of safer sex practices. STIs have previously been thought of as a problem among teens and young adults, while evidence is now showing this is no longer the case. With the increase in prevalence of STIs in this age group, it is becoming an issue that no one can ignore. One also assumes that these older adults have not had to use condoms for a long time, if ever. Because older people do not consider themselves to be at risk for sexually transmitted infections, and because they were never educated, they do not feel that condoms should be a part of their safe sex practices. Sexually transmitted infections, namely HIV, gonorrhea, and chlamydia, are becoming a major societal health issue in Canada and have been referred to as a silent epidemic. A major commonality found in much of the literature on this topic is that the older generation is not interested in having sex. However, STIs are being spread by both males and females. Living longer means a continuation of life and every facet of it. This includes online dating and being sexually active. Many older adults form new relationships later on in life, and it is perfectly okay to do so. However, it is important to be educated about disease transmission. With the increasing popularity and use of erectile dysfunction drugs, namely Cialis and Viagra, among the older population, the incidences of STIs are also increasing. By educating this age group, we can aim to explain that there is no need to avoid engaging in sexual activity, but rather encourage them to do so in a manner that will keep them safe and decrease the chance of them acquiring or spreading a sexually transmitted infection. It's time to take action of your own sexual health practices. This involves educating yourselves about the possible risks and taking the appropriate steps to ensure you are protected. The onus should be placed on the pharmaceutical companies and on the healthcare providers as they counsel their patients about safe sex practices. Many people in this age group feel that because they have gone through menopause, there is no risk of them becoming pregnant, and in turn, they do not see the need to use condoms. However, this is not the case. Condoms are an effective form of contraception to decrease the chance of acquiring or spreading sexually transmitted infections. Condoms are available from many stores as well as given for free by your local health clinic or care center. Using condoms does not mean that you cannot enjoy having sex with your partner. In order to overcome this issue, we as a society need to accept that all populations are entitled to having sexual activity as part of their lives, and we need to give them the tools necessary to be safe. Go to your local community health clinic or see your doctor to get tested and for more information. Don't be afraid to ask questions. It's your right to have access to healthcare and to be educated. Let's talk about sex. We need to get over the fact that it may be uncomfortable to have these discussions. Your local healthcare providers are trained and there to help you learn about safe sex practices. Also, talking to your family members for support and their acceptance is encouraged and should be a positive experience. So let's talk about it. Until society accepts the fact that sexual intercourse does not stop after the age of 50, the older adult population will continue to be a hidden high-risk group for STIs. Thank you for listening to our presentation, and remember to keep the lines of communication open in regards to your safe sexual health practices.